Hello, everyone. Thank you so much for tuning in. I'm Aaron Boers, the CMO at Hyro. Hyro is the leading agentic care communications platform purpose-built for patient access. We power omni-channel conversations across voice, chat, SMS, and mobile, both inbound and outbound. And what we're doing is helping healthcare organizations automate their key workflows like scheduling, handle high call volumes, and improve patient engagement at scale. And we support more than 2,500 hospitals, clinics, and healthcare facilities across the country. And I'm proud to say that includes Hackensack Meridian Health, and they're here with us today. So excited to be joined by Lee from Hackensack, who will share his firsthand experience with Agentic AI, as well as Jim from Penrod, a dear strategic partner of Hyro. He's going to add the marketing and growth perspective. So without further ado, let's start with some brief introductions. Lee and then Jim, please go ahead.
Yeah, thanks, Aaron, and hello, everyone. My name is Lee Kwiatkowski. I'm the Vice President of Patient Access and Digital Engagement at Hackensack Meridian Health. Hackensack Meridian Health, or HMH, as I'll start calling it in this webinar, it's one of the largest health systems in New Jersey. We have 18 hospitals, 500 locations serving millions of patients every year. And me and my team oversee patient access from end to end. So we're responsible from everything from registering patients, scheduling patients, contact center operations, and our patient self-service experiences. So it means I live and work with our physician colleagues on living all the realities about what we're about to talk to today. So, high call volumes, staffing constraints, challenges to make patient access better and better. So looking forward to sharing what this has looked like for us and the impact we've seen. Jim?
Thanks so much, Lee.
Yeah, thanks, Lee. Thanks, Aaron. And a huge special thanks to our friends at HMPS, Daniel there. Jim Slavo, I am with Penrod. I serve as a senior director here, really helping as a strategist with health systems. At Penrod, we're really focused on delivering solutions that truly drive revenue. And in this session, I'm going to lean in, as Aaron mentioned, on the marketing lens. At Penrod, we have program offering that helps people understand how to client with some of the challenges that RC rulings has come through. But once you're compliant, there's another bigger picture to hear of what happens next, right? And so part of what we're going to tackle here is connect some of that ROI from the top of the funnel to the bottom of the funnel. How does the marketing team alongside of people like Lee and the access center teams to truly make sure we're driving the right patient experiences, right? So really excited to be able to share some of that. My background in general, I've been a consultant for healthcare systems for the last 6 years, really working to lead digital transformations. Prior to my consulting, I was over at Franciscan Health, an organization out of India, where I led digital transformation across the enterprise for 5 years. And before that, I was in for 23 years. So we're trying to bring retail to healthcare, as all of us knew. Let's make this a simpler experience. So excited to be here. Aaron, I'm going to pass it back to you.
All right, awesome. So really wonderful to have you both with us. And I think we'll kick it off with, before we start talking about measuring success through concrete ROI, I want to ground us in why healthcare organizations are investing in agentic AI in the first place. And I know Lee touched on this a bit. So earlier this year, we actually commissioned an independent study with a third party, and we spoke to about 400 healthcare leaders, director level and above, who are already implementing agentic AI. So they've already adopted. And we wanted to understand kind of the state of agentic AI within that adoption as it relates to patient access and contact centers across the US. And the findings were insightful. Maybe for some of you on the call, these are obvious. They did confirm what we're consistently hearing from some of our customers. So I'll just highlight some of the bigger ones here. I mean, 56% said long wait times and call abandonment are the primary drivers behind their AI investments. Nearly half reported that scheduling demand has become unsustainable. 46% said they still don't provide patients with after-hours access, so it's kind of like a 9-to-5 shop. And then 41% are facing staffing shortages they simply can't hire their way out of. So all these represent the operational realities that healthcare organizations are really navigating daily. And when these challenges go unaddressed, the impact can extend far beyond the contact center. So patients wait longer, delay care, or give up altogether and potentially churn, right? So a lot of challenges to overcome. And I'll turn back to you, Lee. I mean, how closely did those findings reflect what Hackensack was experiencing before you implemented AI agents?
Yeah, I don't think any of those the responses or data points are surprising. They all look very familiar. I would highlight one big one. I think it was maybe under the staffing shortage bucket or budget pressures, right? So our access center, we're currently fielding 3 million phone calls a year. We've got a limited number of resources, and we've got a queue of specialties that we're still trying to get onto our access center. So we're on this journey of growth while facing pressure around, call it dollars per patient, like all organizations, right? And like most health systems, our labor accounts for the majority of our operating budget. So every dollar we spend on repetitive tasks, administrative tasks, is a dollar we can't spend on, that high value delivering of care, getting people investments in the top of licensed clinical care. So we also work in a very high, access centers in general are a high turnover environment. So, anytime you have to reinvest in an FTE, it comes at a 1.3 times the cost. And finally, I really focus on employee engagement with my team. So eliminating any redundant steps, remedial work, kind of that dehumanizing work. The more we can take off their plates, the more engaged they are, the happier they are, the less turnover we have. So that's all to say. That was, again, budget pressures, I would say, was our biggest driver. In addition to the usual, we're always looking out for our service levels, making sure we're answering the phones in a timely manner, not abandoning patients. And then finally, a lot of patients want more self-service options than we'd offered in the past, right? So patients, in many cases, don't want to speak to a human if they don't need to. So that was another driver of us leaning into the virtual agent realm.
Fantastic. Really insightful. Thank you, Lee. And it sounds like there's a lot of domino effects there where a lot of those have linkages. And it seems like the strategy from Hackensack has been spot on in that regard. And I wanted to talk about some of the things you mentioned, Lee. So, 3 million calls, there's attrition. Obviously, there's capacity, there's containment to look at. Um, there's a measurement gap for some health systems, not necessarily for Hackensack, but I wanted to talk about that measurement gap. And by the way, for those listening in, we're going to kind of switch between today discussion and then also showing you a few stats from this new report, since we think that it kind of guides the conversation. So just so you understand the flip-flopping of the format. But so let's talk about this measurement gap. So again, from the same survey of 400 healthcare execs, director and above, 94% of healthcare leaders across the US said that measuring AI agent performance is critical or important to their strategy. So the intent is there, but then we see that 40% are still relying on some of these informal ad hoc methods to measure some of the outputs, outcomes that are meant to overcome the challenges that Lee was just talking about. So that's the gap. And it's not just an analytics problem, it's a credibility problem. When you can't measure it, it's harder to adopt, scale, and of course, improve upon. So moving back to Lee, we spoke about agents previously and some of these challenges. So they're going to, again, 94% of colleagues saying measuring AI performance is critical, half of them not really being able to or not getting there. Before you had a formal approach to AI agent performance, how are you evaluating success in this domain? What did measurement look like for you?
Yeah, and again, I think, just to be honest, I think most organizations, whether it's healthcare or beyond, are still figuring out the formal measurement strategy. I think we've got formal strategy in some areas, but we're still working on others. So, specific to some recent investments we've made in intelligent virtual agents, we started in, what I'd call an ad hoc bucket, where we just needed to prove the concept that we weren't going to break the system in working with our practices and getting our patient feedback. So, initially, when you're in a pilot phase, again, just proving the concept, an ad hoc approach works. Once we cleared that pilot phase and we're ready to scale across many practices, across the network, that's when you really need to look at more formal, more robust ROI metrics So I think the first place we looked was labor cost savings. I mentioned the budget pressure. So you're going to hear a recurring theme here. So, really being able to convert the time saved to labor cost savings. And then in addition to labor costs, improved provider utilization. So we're constantly trying to make sure we're getting the most out of our provider templates, right? We've got physicians in the office. Let's make sure they're busy all day. So provider utilization is one. Reducing of delays to care is another. We're constantly trying to get patients in sooner with the right modality of visit. And then finally, starting to have a thought around contribution margin. I know you don't want to dehumanize patients in that way, but at the end of the day, there's a contribution margin related to every patient that moves through your system. So another formal way that I've seen work well to justify big investments is identifying, for every new patient that comes into the system, what does that look like downstream from a contribution margin standpoint? And I'll probably talk a little bit more about that as we move through the presentation.
No, but great start to talking about measurement, which obviously is a big topic for the discussion today. So thank you for that. And now I'll talk a little bit about what ROI actually looks like. So when measuring performance, we asked, again, these healthcare leaders what ROI looked like for them. We're still figuring out, to your point, Lee, we're still figuring out on the vendor side and the health system side, across, I think, the landscape of how to kind of categorize a lot of these. And health systems, it's like when you've seen one health system, you've seen one health system. So there's all these different ways in which that they're measuring success, whether that's operational, administrative, or clinical. On the patient access side, more or less, this is where those were bucketed. So we had three major categories that came up quite a bit, which was acquisition, access, and engagement. So acquisition, an example being AI-assisted scheduling that brought new patients in, tying that to downstream revenue. Access, which is about call resolution, appointment automation, 24/7 coverage, and then engagement. So no-show, reduction in no-shows, patient experience scores that compounded over time. So good improvement in PSAT. So those were some of the results we saw in the report that we ran. And then healthcare native deployments, what they were reporting, these healthcare executives, is that with healthcare native applications, they were seeing about $720,000 back in terms of the average ROI annually, versus the $586,000 industry average across other types of solutions. And then 92% seeing operational value within 6 months, which is a big improvement from where we used to be in terms of chatbots. So that's kind of becoming the new bar for time to value. It's just a few stats about the kind of ROI we're seeing across health systems in the US. Lee, I'll turn it back to you. I'd love to hear about what you think in regards to return on investment for agentic workflows, how that should look, or at Hackensack specifically, what's kind of delivered the biggest value in terms of your own deployment?
Yeah, we've seen some results thus far. Basic containment rates, right? So we identified 15 to 20% of all calls coming into our system could be handled and contained with a virtual agent, meaning that's 15 to 20% of calls that are no longer needed to be fielded by my team members. So it's easy to do the math there on ROI. That's time saved that we can apply to growth or apply to labor cost optimization, whichever approach is needed. We did see, again, improvements in abandonment rates and service levels. Again, back to that 15 to 20%. If you reduce the volume that can be, or that is required to be taken on manually, you improve those service levels. And then an interesting one when you think about growth, right? So we're trying to expand. We've got pent-up demand, and when you eliminate some of the calls or patient interactions that are the basics of office hours, I need directions, I have a med refill request, and offload those and focus more on the scheduling of complex visits what we see is an increase in, again, provider utilization. So there's a growth story here that if you can handle the easy stuff that's generally not leading to more visits or more patients, it does free up capacity to be focused on growth. So we've seen, again, an improvement in utilization and ultimately growth of new patients for the organization. As we continue, I'm really interested in watching employee engagement. I mentioned it earlier that if you take some of the remedial work off of the plates of our team members, we're really hoping to drive more time for complex, more collaborative work with our practices, and ultimately retention rates. So those are a couple of things we're really focused on. I don't have a full year under my belt yet in terms of watching the data, but we're really hoping to see engagement and retention rates improve.
Excellent. Thanks for that. And yeah, those sound like two excellent objectives in the next phase of things. So I'll turn it over now to Jim for the more marketing and growth perspective.
Yeah, thanks, Aaron. And so I want to make sure we're very specific that we're not changing conversations here. What we're going to do now is we're going to talk about some of the things, Lee, that you were just mentioning, right? Is how do we connect all this together? How do we increase demand? How do we make sure that we're looking at growth and measuring what's working, what's not working? And how do we do this between, across collaborative, right, between like access teams and marketing teams, right? And so when we think about healthcare, and you've hit on this a couple of times, Lee, right? Measuring return on investment in healthcare is really more critical today than probably before, right? I mean, we're all working on these razor thin margins, massive shifts towards like value-based care, and then just overall rising consumer expectations regarding how they get access to care, right? And the digital components, right? They expect us where they're at, whether it's digitally or over a phone. So we need to be ready, right? And so when we think about what's worked and how do we measure things, I'll share this as a leader in at this from a marketing lens. We've generated a lot of success with one mantra here, which is basically like everything needs to stop with data. You made a really good point that patients are people, and that's the most important thing. But I've always also said, there's no money in healthcare, there's no mission, right? So making sure that we're tracking to the contribution margin is you have to do, and leveraging that to align executive leaders is critical, right? And when we think about the framework here, and that's really what the key is, it's a framework that can be reproduced at different places. We know that, like today, we have to look at the patient experience across the entire funnel, the way they engage with you, and it starts with the funnel, right? In how we know, like in our current environment, the gateway to health for pretty much every system is going to start with a click somewhere, and we know that more and more everyone's leveraging, including us, AI through answer, right? Before they even land on a website these days, before they make a call. So they're not even going to get to your team until they some sort of click or a search in order to even get there. And so the goal we need to do is we need to understand how to measure those things, not just at the top of the funnel when we think about our search budget, our social budget, maybe our programmatic budget as a marketer. How do we align those very specifically to this person took this action on this website, led to a phone call to Lee, or maybe a self-service approach, and how do we tie that down, not just from top of the funnel, but all the way through that they actually an appointment and then they completed that appointment, actually had that revenue that's attached to it. Like that is the picture, right, that we need to connect. And the question is how do we do that, right? And so right now, we know healthcare organizations spend really hefty budgets on those things like the paid search, the social, programmatic. But without connecting that ad activity to the downstream patient scheduling, those exam room visits, and the revenue data, we're really only getting half the picture. And that's I see the time, and it's painful. The way we have to, and this is really where we're seeing a shift in the industry, you have to really bring the data together, right? We know that these are really becoming a very important thing in every healthcare organization. And now with that approach, able to start stitching together patient data, the provider data, the scheduling data, tie it to the marketing data and the engagement behavioral data that those people are taking, whether it's third-party ad side or on your website, and all that behavior is being captured. We need to be able to take that data and stitch it to the person. Way we can really understand what they did and what they did, and really how do we take that data and then put automated campaigns that start nurturing the next step, whether it's drive them to the appointment, whether it's giving them post-acute care actions after an appointment, right? All of that matters because we have to look at this in a holistic view, right? So with all that being said, right, I think the bottom line, we need to double down really on understanding what actions from a marketing perspective, what campaigns not just drive clicks, but actually drive the outcomes of getting those exam rooms filled. And to your point, Lee, doing a better job of filling those open slots for those providers, right? That's where growth really comes in. So on that note, Lee, how have you been able to kind of patient access to revenue? Like, how are you all doing it at Hackensack?
Yeah, it's a great question, because whether you're a contact center, an access center, or looking to invest in a new, AI technology, we need to rationalize our existence, right? I need to rationalize my team's growth, and to do so, you need to be able to convince the CFO that there's real revenue and real either hard savings or hard revenue attached to growth. So, there is a way to connect access improvement to real revenue. I like to think about cardiology as a subspecialty that you can really demonstrate the pull through of every new patient that enters the system. As a new patient to the cardiology practice, they may have an initial office visit. It's going to net $200 of revenue to the organization. But when you start talking about half of every cardiology patient is going to need some diagnostics, in the outpatient setting, there's another $500 to $1,000 revenue, and 8 to 10% are going to require procedures, and you start to get into some serious, dollars there, and then ultimately inpatient stays. So the point is, you really need to be able to connect the dots of that new patient landing in your system and the pull through, and getting people aligned with a model that is viable, credible, and isn't perceived to be, soft. So, and that you have this contribution margin model throughout a health system to really rationalize why is improving access so important. The other thing I experience is we've got a lot of specialist shortages, right? So there's a 2-month wait time to get into neurology. That you name the health system, that problem exists. So while we may have a lot of providers they don't have any room for more patients, what can we do to get the right level of patient to the right provider or the right modality? So we all know more and more there's virtual care, there's e-consults, there's e-visits, there's maybe messaging to the care team that can, in addition to maybe lower level, mid-level providers like APNs, all things we can do to alleviate some of the demand off of the physicians in this case, as I was mentioning. So there's another element of improving access to really increase the complexity of patient that we're seeing at that top level provider, in person, what's really eating up their time, and then where possible, move the demand for the simpler patients and acuity to some of those other modalities or other providers. So the point is, that's a second way to connect access to revenue is, a higher acuity mix or more complex patients being seen by our physicians.
Yeah, and so I appreciate you sharing that. And so this is where we won't get too deep into the call, but you hit on a really important topic. It's driving and identifying the right mix of patients. The more complex patients we obviously, the better and more can deliver, which then back to financial standpoint, right? The revenue gets impacted, right? Are there any gaps today around some tracking restrictions on how looking at complex patients versus just their standard, kind of general access questions and standard screenings and things like that? Is there any gaps on how you're tracking or restrictions are impacting the way you're tracking the metrics?
Yeah, I think when it comes to like tracking the funnel experience or tracking that attribution, I a long wait time will, you might have the best campaigns and the best outreach and the best awareness of providers or specialties or locations in your system, but if the patient then goes to make that appointment and it's a wait time longer than they're comfortable with, they're going to go elsewhere. So I think that things might break down when you're trying to marry that awareness to retention. If there's friction from poor access, whether that's long wait times or just like complex processes that break down. So again, hard to realize some of those investments upstream if we've got downstream processes that are just loaded with friction.
Yeah, oh, that's spot on. And so I appreciate that. And so I'm going to share a little bit of what we're seeing. And keep in mind, right, this is really about what you just about, Lee, right? What happens after that click? And you framed that so nicely, because as a marketer, we work really hard to make sure we're identifying the right people to bring in the system, that we're making sure that we've got the right content, it's delivered at the right time to the right patient, giving them ability to take advantage of various paths into the system, right? Whether it's, again, those self-service digital tools or making a phone call. But the problem does lie if that experience is disconnected, or if they're running to gaps in getting an appointment that wait 4 weeks, right, to get in, or 6 weeks, or sometimes, God knows, we know 3 months to get into PCP, or waiting on, right? All of those things start to limit what that attribute can look like, right? So when we think of some of the experiences that we're doing here at Penrod alongside of Hyro, we are able to really start looking at some pretty cool metrics that, frankly, we all care about, right? This is because the one that I spend a lot of time in and we look at is we work together in terms of operations and access, patient experience situation, and marketing patient experience situation, right? Clinical care we all have that in common. So we need to make sure that we're breaking down the silos and working together to create that seamless experience, right? But when we do that, we're starting to see some data roll in around what happens after that, right? And so once a patient reaches out and the return gets measured, we're measuring this in terms of like, how are we resolving their, right? It's not necessarily about deflection, right? Which is, I see a lot of people starting with AI. It's just like, oh, let's just worry about how many calls deflecting, or how many things we're not have to have a human interact with. And that's important. You've mentioned that's a big part of it. But the bigger part is like, have we given them the path forward? Have we solved their problem, right? And that's really the key thing. And you mentioned some of those things. So we're seeing, like, when we implement a solution like Hyro, able to start seeing about 85% of the patient interactions are resolved, right? So it's more of that first call resolution through technology that's put in place, along with some of the data that some of the Agentic look up and have access to, right? We're starting to also see that call abandonment goes down, right? Which is a huge thing, right? We don't want people, to your point, getting on the call and having to wait too long and they're just dropping, right? So we're able to improve that. We're also starting to see, again, this is a bigger shift digitally, is that more and more people will like to take the self-service path online if they can, right? And as long as we know that they had a successful outcome with that agent or with that AI experience, a digital approach, great, we're good there. But those we have to measure and track, right? We don't want to push them down a digital path for them to still not be able to schedule an appointment, right? And then the other thing too we're looking at is just overall, we're starting to see operational costs go down. Without having a head count, we're able to do more. And I think that's the biggest thing that we're trying to accomplish in healthcare from the contact center standpoint. Take that, couple it with more staff is now having more capacity to focus on more complex situations, right? And complex patients. That's a good thing. We want to make sure those agents are able to do that. Some of the work that we're doing now opens up a path forward in that after hours section, right? You know, that, like, even though it's after hours, historically you couldn't schedule and make a move. You had to wait. We're now up that access there, right? We're also putting automations in place to reduce no-shows, right? It's through a call center, or this is where we've seen a lot of marketing. Where marketing's helped the call center in a lot of my situations. We'll say, hey, let's start doing outbound communications and send some outbound emails, text messages that allows the phones to get where more patients are calling back in or self-scheduling online. And that takes some of the burden off of the call centers as well, right? So ultimately, all this to sum it up, these are really the ways that we measure how are we resolving these issues. They all match and map to that downstream revenue number. I think that's the real key here. So on that note, beyond, say, automation rates, right? And Lee, I'm looking at you here. What has proved to be kind of like, how are you measuring where the patient experience is starting to get better now that you guys have started implementing some more of these tools?
Yeah, and I think that the answer to that evolves over the course of the journey, right? I think we're all getting more comfortable with interacting with virtual agents. 2 years ago, I would personally not have been as traditionally not. I don't interact with virtual. I was not interacting with virtual agents in a way that I do now, and I think that's the AI acceleration it's been a game changer. So, but there is still this stigma with some people, some patients engaging with a virtual agent. So one of the first things we did early on is track the number of patients that call in and request an agent right away, right? So they barge in and say agent, right? That's an example of, we've all experienced that in our everyday life. And it actually surprised me. We have a very low number of folks that do that. And that number has improved since we started turning on the virtual agent in our practices. So that suggests to me people get used to it. Like, first of all, they didn't revolt against it, and they're getting used to it, so that we see that number go down. And that's very specific to people's response to dealing with a virtual agent. There's also anecdotal where, many physician chiefs are very protective of their practices and their patients. And if they have a perception that this virtual agent that you all have dropped into my practice isn't working, I'm going to hear about it. And I honestly have been surprised that it has been well received by even some more tenured physician leaders throughout the network. More robustly, there's traditional patient experience surveys where we've got specific questions around ease of access, ease of scheduling. But more importantly, the comments that we get back from our patients are rich with feedback. And again, it used to be that filtering through thousands of comments was prohibitive, but now, again, with AI, we're able to, imagine a word cloud or easily extracting themes that we're hearing from our patients related to virtual agents or when I called into the office. So we're monitoring those patient experience comments pretty thoroughly, and again, have been impressed with the positive or neutral feedback that we get related to the engaging with a virtual agent. And then,
yeah, can I ask you one quick question here? Because one of the things that, again, as we think about, again, the overall experience, but how internal marketing teams and analytics teams, right? Because when I say marketing and analytics, in my world, we always make sure it falls apart. But how they work across this access and how we're measuring these things. How are you balancing some of the automation targets against the patient experience in terms of, like, when are you moving things away from maybe an automated approach and then connecting them to a live person? Are you looking at metrics like that and making sure that you're really aware where there might be additional friction points? And what does that look like?
Yeah. I mean, the bottom line is you have to meet the patients where they are, right? Yeah. Automation, self-service, dealing with virtual agents works for some patients, not for others. Mm-hmm. Might work for simple or more simple health conditions, more simple encounters needed from a patient, but more complex subspecialties do require more human interaction, does get into more complexity that maybe our systems just aren't there yet. So it's really a balancing act, right? So if we lean more into automation and more patient self-service, are we seeing a positive or negative response from our patients via patient experience data? So it's that balanced scorecard approach, I think, that you really just have to triangulate, and it's not one size fits all for the patients. It's not one size fits all for the subspecialties or hospital-based versus physician office-based encounters. So you really have to get into a balanced approach from a horizontal and vertical way across metrics.
Yeah, and I think you said it best, meet that patient where they're at, giving them an off-ramp to say at any point in time, if I'm not getting what I need digitally, I can connect to a live human without an issue. And that information gets seamlessly transferred so I don't have to repeat it all. And that's the other part of what we're trying to accomplish here. Yeah, this is great. All right, well, we'll keep moving. Aaron, I think I'm going to pass it over to you. You've got a really cool kind of framework that I think comes into a lot of the stuff that Lee and I have been chatting through.
Yeah, absolutely. So this is just a practical three-tier model. Again, there's no, there's quite a few ways to develop a framework for measuring AI agents and their performance, but this is just kind of a practical three-tier model that the room can take home. And really, we looked at three tiers that kind of earns the next or build on each other. So we got operational efficiency at number one, and that's, to your point, looking at hours saved, containment rate, time to value. I know you talked about these, Jim, a bit in the slide before. Those are a little bit easier to measure. And then tier two, something like, looking at individual buckets or workflows and saying, okay, how many appointments did we see an increase in appointments scheduled, for instance, come through, or a decrease in no-shows? And then tier three, and this is really where you start to see CEOs, CFOs weighing in. And this is now something that's being more demanded by health systems, is hard annual ROI, and looking at the revenue associated with those other two tiers. So looking at, okay, maybe we increased the amount of appointments that we booked by 25%, pre and post. What are those appointments worth? And obviously every appointment is not worth the same, and really getting more granular about it and being able to stand by that revenue per workflow that these health systems are automating. So those are just a few examples, right, of the different tiers and kind of a framework to take home. I think, Jim, I'll pass it back to you just in the interest of time. I know we have quite a few slides to go. So I'll skip the question on that one and just kind of go back to you to continue.
Yeah. So let's talk about this, right? And this is really where I've spent a lot of time with a lot of health systems across the country over the last 3 to 5 years. It's really about how do we get ready for this AI push, and how do we back into an approach that's going to make it not just successful but adoptable, because that is a big part of this, right? And so what we've found very, very consistently, it is less and less about the technology and more about the alignment and the strategy, right? How are we going to go to market? How are we going to not just create the patient experience, but an important, how do we market it effectively against that patient experience? And then how are we also communicating and working cross-functionally internally, right? Between marketing, between access, validating, with clinicians and how we want to go to market with things. And then also too, to what we've also been talking about, aligning with our executives on how are we going to measure success on this? What are the KPIs we're looking at? And so we really need to look at this holistically. And when we start to break this down into what the buckets are, the biggest piece here is validating what are we trying to solve for? What data do we have? And let's go back to this, starting in with data. What data do we have to help guide us on where we should get the most value, and where we can get the most internal buy-in from a trust standpoint, right? Lee, you talked about that earlier. Trust within the organization is a really big key piece of the foundation. Understanding when we can start, how we can start, and confirming we're not going to run into any real patient hiccups, compliance issues, right? Things like that, to make sure that we can move forward. When we move and set that foundation of being able to align on where we're headed as a North Star, this is where we need to do a really good job on mapping out the content, right? Because again, we can't just build a system and think people will come and use it. We also don't want to, there's a bit of a balance here between what our overall state of expectations consumers have, in addition to how do we walk them and teach them what to expect. And that's where marketing come back into the picture. So we need to build a consistent kind of omni-channel launch strategy across website, email, SMS, social, right? And then in-person touch points, phone, and then just importantly, make sure we're mapping all those KPIs to validate what's working, what's not working, right? That internal adoption is really, really important. Aligning internally with the staff. Lee, I know you've probably done a ton of this when you guys were not just definitely prior to rollout. Here's what we're doing. Here's how it impacts you. Here's how we handle these scenarios. This is what we are doing. This is what we are not doing. This is where we're compliant. This is what we would never do, right? All of those internal kind of governance conversations and operational planning is critical, but it has to happen across these teams: marketing, data, IT, access, financial, all of that. We have to be aligned. And that is a really big part of what we've been spending a lot of time on here at Penrod with our program. So then when you get to the overall kind of like launch phase, then we still say, okay, well, what happens after the launch phase, right? So at that point, going live is not the finish line. It's actually really the starting point. At that point, we have to make sure that those programs, they work the way we anticipate. Nothing ever does go perfect in healthcare. So we've got to be agile and be able to kind of shift and move things forward. But what we will, within the first 90 days, we're going to start to see how it's being adopted, what's working, what's not working, as long as we've got the dashboards in place with the KPI. And we're going to be able to have a pretty quick, compelling story. And we've talked about some of the data that we can see there. Right. And then from there, it really is what we should always be doing is how do we continue to lean in with the data, right? Let that data tell how we can then go and improve things or something that's just not been a good experience. And that's really the key here. But I'll go back to this where marketing works in very close conjunction with access and other operational teams. We have to do this together. This is not going to be solved in a silo. That's for sure. So that said, so Lee, this is where I'll go back to like, what did, how did your teams kind of tackle that trust and really kind of embrace like in terms of like planning for this? Because there is a whole state which we call data and AI readiness to know what's coming before you can't just turn AI on, right? How did you guys get there? And any tips for everybody?
Yeah, I think there's a critical step or a critical messaging component at the beginning of an engagement that is we have plans for growth. We have more demand than we can keep up with today. So AI is not going to do away with any jobs, right? So job security, like in terms of frontline staff, providers, you name it, making sure that message is very clear. And then really confirming that our patients are going to accept, engaging with an AI agent in that case. So doing things like we sent around recordings, like here is a sampling of patient interactions from our proof of concept practice, and just get people comfortable with the way these conversations flow. Because again, things have evolved so much. So people hearing it, whether that's a manager out there in a clinic or a physician, we sent around recordings and said, listen to how this goes and try it yourself. Call in and have a conversation with the virtual agent, because it's a new day. And I think just to lower that stigma, we did a lot of just having people try it themselves, and then live through a pilot and listen to your patients, right? And you'll hear if they're buying into it or not. So kind of a multi-pronged approach to building that trust across the rollout.
Yeah, pre-active and then after launch, continue to be proactive, right? Exactly.
Yeah.
All right, so I'll keep rolling here. And I know we've got a few more things we want to cover. So the biggest thing here that we want to make sure that we're really tying the picture back to is the whole, this webinar is on Show Me the ROI, right? And we talked a lot about ROI within these individual moments, whether it's schedule, call resolution, right? Started talking a little bit more about marketing attribution. I think the key thing that we want to make sure that we're cognizant of, and this is why this is an enterprise approach to success. When we think about ROI attribution, marketing today, in today's world, working analytics teams, we tend to have the data to align on what is that storyline, what is the picture, right? We moving patients successfully across this entire health journey that they're going on, right? And that is the thing, right? Like, we know patients don't experience healthcare in silos. Therefore, that data being centralized, making sure we've got the right KPIs to validate what's working and working has to be present as we move forward. It has to be a group that really owns that storyline and owns those KPIs and owns those metrics. You know, Lee, you and I talked a lot about growth. That's the common throughput here, is we're all leveraged and landing to drive growth. The other key thing is the retention, right? Once we've landed maybe a net new patient, how do we keep them, right? How do we make sure that they're coming back? And how do we ultimately improve their patient value with us? And it has to be done, again, as looking at the patient experience across the continuum of care, not in buckets and silos, which is a lot of healthcare still doing, right? So we're not automating one touch point, right? We're really building this as a overall program that can consistently deliver over and over, time and time again. So on that note, when we start to think about potential, what's working, so for Lee, you've shared that you've worked across the lines with marketing counterparts, right? Is there one initiative or outcome that you can say, hey, we really learned a little bit more when we started working across the aisle to leverage AI? I'd love to hear a little bit of a quick story, if you have one, that can say, hey, we found some real value working cross collaboratively with marketing to do X, Y, Z.
Yeah, I think it's this where we've got access, let's promote it, right? Yeah. So if we've got a practice or a specialty or a region that has capacity, has great access, let's get that message out there, whether it's a campaign directly to our patients or to the referring community. Let's make sure we're promoting and really making it frictionless to get patients into those practices that have capacity. And again, when we do access improvement work and we get our wait times down, you know, organizations have different mantras with this. We have one that is today, tomorrow, next week, right? We're able to see you virtually today. If you need to see your PCP in person, we can do that tomorrow, and we can get you into a specialist next week. And again, once you've achieved those operational commitments in terms of access, partnering with marketing to get that word out there, to continue to message, you know, a leg up against the competition, or a leg up in just getting patients into the system.
Yeah, no, I think that's super critical, because I think that's the key. And a lot of marketers will work off of a scorecard in alignment to say, hey, this is where we see demand, and let's and access, and then let's also tie that to that contract margin to say these are the patients, or cardiology used as an example, is to say this is where we know that we've got pretty high contribution margin, we can drive a lot of growth, right? So we have to, this is where that really makes sense, and then we have to continue to measure it. So yeah, I think this is fantastic. So I know, Aaron, I think I'm going to back to you again, because you've got another really cool stat slide here that you'll through.
Yeah, I appreciate it, Jim and Lee. And speaking of scorecards, I mean, it's a good segue into kind of a scorecard that came out of the report that we did, asking healthcare executives, you know, what are the types of AI agent vendors that they went with, and kind of what they're seeing in terms of all of the key metrics that they weigh those AI agents on. So speed to value, routing accuracy, resolution rates, appointment automation, capacity gains, and annual ROI. Those were kind of the core that we focused on. And we saw that there was across the board just the notion that when you're healthcare AI native and the core competency is, you know, are developing these AI agents in tandem with healthcare and their deep integrations, et cetera, you do come out on top. And then on some of the other ones, there was a clear disqualifying gap. So we saw some gaps in CCAS, in industry agnostic as well. CRMs, and then EHR native, which have quite a way to catch up, mostly in terms of speed to value, as well as accuracy, but not just. So really interesting for anyone who wants these stats. We do offer CCaaS is the telephony platforms. So Cisco, Genesys, NICE, etc. To the person who just asked that. So if we want to continue, just in the interest of time, I do want to get to all the questions that we have. We can keep going, Jim.
Yep, sounds good.
So I just wanted to ask Lee, and then we'll move on to the chat window. Looking back, we just talked about a few different categories of measuring AI agent performance. What's one question that every health system should be asking during their evaluation, implementation, production with these AI agent vendors? I mean, what's one burning question that every health system should really have top of mind as they go through this journey?
Yeah, I'm going to give you two. They'll be quick, but first thing I always ask is, what other health systems are you currently fully deployed with, right? So there's a lot of beta usage and trials and partnerships out there, but I want to know who you're actually fully deployed with so we can see it in action. And then the second is, can you put me in touch with that health system to really get their perspective on that health native or healthcare native reality that I love to see in our vendors. So two questions I would start with.
That's great. Thank you for that. And I'm sure that's actionable for those on the call who are kind of starting this journey or even in the middle of it. And I'll just end now. There's two barcodes here, of course, with some really interesting materials and things you can download. So the stats we've been referencing are from the Healthcare AI Agent Benchmark Report. It's new from this year, 400 healthcare executives. So feel free to go grab it. And then, of course, we've got the Penrod audit. And if you like to go the marketing route, that's a great asset as well. And three things to take back with you. So ROI starts with measurement. If you can't measure it, you can't really improve it. Resolution beats deflection. So it's nice to say, we've deflected all these calls from our agents, but the real meat of all of this is being able to resolve those patient tasks, right? And so it's one thing to keep the inquiries away from staff. It's another to actually complete the workflows and have them deeply integrated with the health system. And then the other is treat AI agents kind of as a growth strategy, and look at them through that lens and how it can improve both operational efficiency and also patient access metrics that matter. I'll just move on now to the first question that we got in the chat. And Lee, I'm not sure if you'll have an answer to this one, but it was a good one. Do we track cost per call, or do you track cost per call by call type? And if yes, what type of reduction have you seen when implementing various AI use cases?
Yeah, great question. And we're partially there. I don't have it at my fingertips, but we do measure cost per call. And as I alluded to earlier, just by implementing a basic intelligent virtual agent to do things like address what are your office hours, what are the directions to your clinic, I need to place a med refill, we saw that 15 to 20% containment rate. So that's a direct correlation to 15 to 20% reduction in cost per call. We are doing things now, we're adding in appointment management, and the more you can do with a virtual agent, enabling more patient self-service, that number goes up. But I can safely say that 15 to 20% reduction has been achieved using the virtual agents thus far.
Excellent. Excellent. And I have another question that came in. So what strategies do you use to accelerate rollout, including everything from operational design, data stewardship / hygiene, and change management? That's a fantastic question, actually. So yeah, I don't know, Jim, Lee, if one of you wants to jump in. I have my own take on that question, to be honest. But yeah, whichever one of you wants to go at it first.
I can go quickly. I think Jim and I hit on it a bit before. I think that the messaging around this is not going to take away jobs. This is enabling more growth, right? And then being really clear on what the objectives of the implementation is, whatever it may be, just being really clear. And the last thing, and it's almost counterintuitive to what I just said, but you learn as you go. Like, we're all learning what these models can do for us, what these agents can do for us, and just in a safe environment, maybe a proof of concept environment, just start trying different use cases, and you learn, and you have light bulbs go off. And so anything you can do to have both a very structured rollout approach while also keeping, experimental opportunities out there. I think everyone's still trying to learn the best use cases for AI.
Yeah, and I would on top of that, there's a mindset that goes to this, and so the fastest rollouts, right? Going back to the question of how do you accelerate, the fastest rollouts that I've been able to be a part of, again, it doesn't go back necessarily to the most advanced technology. Obviously, there are prerequisites and requirements there for certain types of systems, but it's really about a unified view and treating law more of a discipline. It's not an individual like an IT implementation around this technology. It really does layer around the organization. And they're back to some of those, like the 4 stages, which is that foundational readiness, right? So before single patient sees an agent, we've got to make sure that we get that boring, behind the scenes, unglamorous stuff done. Data hygiene's got to be accurate. The system's got to be integrated. Compliance has to sign off. And really about like identifying the use case for these agents, right? Most rollout delays really it's not a technology thing here. It's really more of the data and governance piece, right? So that foundational readiness is stage 1. Stage 2, the messaging and content, the KPIs. Are we aligned on really what we're doing, how we're doing it, how we're tracking it, how we're promoting it internally and externally, and what that experience is going to be. And then I always like to call this road showing. It's that external road showing, right? So it's that change management piece. What are we doing internally to level set expectations and align on what we're doing and we're not doing? And then it's the optimism is the 4th piece. How do we continuously learn? You hit it right on there, Lee. This is such an uncharted territory. And with technology evolving, things change week to week around what's available and what's possible. We don't have the right mindset to understand it's not going to be perfect. We don't get it, but we do have the right guidance to make sure we're not creating bad access for patients that's going to push them out of the system, right? Or going to really upset a provider, right? To where they're like, rip it out. As long as we have the right girls, we just have to understand it is a mindset of ongoing learning, and keep looking at the data to validate what we do and what we shouldn't do.
Yeah, and I think those are both so on point. I'm going to pass it back to Daniel now to give closing remarks, but I'll just say what we've seen. I've been in conversational AI now for 10 years, and what we've seen when it comes to AI agent rollouts is occasionally the bottlenecks. Most of the time, the bottlenecks are not related to the capabilities of the technology. It's not about the voice experience, or it's about a lot of the legacy workflows and the decision trees not really being ready. Which has to do with data hygiene, but also has to do with change management and the will to adopt. And adoption levers are probably the most important thing to align in a health system with. And some of the best, most progressive health systems we work with, the CIO comes or the CTO comes and says, how can we help you in order to make this successful? And what does it take from us? What will it require in terms of change in order to make this successful? And they ask us for templates, and they ask us for frameworks from other health systems that we're doing this with. And so I think that is so critical, and both of you touched on it, but I just want to leave that as a critical point. Adoption levers are some of the best things that you can have in a rollout like this. Daniel, I'll pass it back to you.
Terrific. Thank you, Aaron, Lee, and Jim, for sharing your expertise and insights today. It was a terrific discussion, and we appreciate you taking the time to be with us. Thanks also to everyone who joined us. We hope today's conversation gave you practical ideas for measuring the impact of AI agents and demonstrating ROI within your own organizations.